much. It's good to be here, and I'm glad to have Mary with me, too. I'm Joan Hogan, welcoming you to the Prairie Doc Radio program. Rick Holm, our Prairie Doc, is in the studio, ready to answer your questions of a medical nature. Dr. Holm's specialty is internal medicine. He's a primary care physician with the Avera Medical Group Brookings, and he's also a clinical professor at the University of South Dakota Sanford School of Medicine. Good morning, Rick.
Good morning, Joan. Good morning, Mary. Good morning, Bob.
Mary made a point of being nowhere near the microphones. She said, if I come, can I just stay in the corner? And she's in the corner. But she's a sweet girl. We're glad to have her here.
I was going to ask her a question, you know.
You could ask her a question. Can you come up here and answer?
No, she doesn't.
She can be mute if she wants to.
I did too. How many boyfriends?
Yes.
Oh, she did not want to hear that.
How many boyfriends?
Oh.
There will be a boyfriend one day.
One day there will be, because Mary is a winner.
Yes, and it's nice to have you here. This is a joy, and I love the fact that you and I worked together on this project, on this radio show for how many
Long
years?
before Mary was born, probably
Yes.
25 years.
We've been saying 25, but I think it's more than that.
Well, I want to say it was between 92 and 94 that we started. I'm not sure the exact date. I know it was between those two dates. So let's say
really?
92. How's that? Between 92 and 94.
So that's
How's the math?
24, 92, that's 24. Yeah, 24 years.
Okay.
How about that?
It wasn't before 92.
Okay. So there
It's about
it was.
the only date I
and
have.
you know that because?
I know that. That was rather a watershed year. My youngest daughter left for college. I started college.
Oh, that's right.
I went back to college in 92, graduated in 94, and somewhere within those 2 years, you caught me and said, you're studying that. Why don't you help me with this radio show? And that's where we got
There we
started.
go.
So I knew it was between those.
And you stopped selling shoes in
92, and 92 as well, yes. The shoe store closed up in 92, and the daughter, who was starting college, has a birthday today. My
really?
baby's birthday. Happy birthday,
Happy
Molly.
birthday to you,
I should
Molly.
tell her to pull up the link, and then
Yeah,
she'll
she
know.
can
We
hear.
talked about her on her
Yes.
birthday. Yeah.
Well, we
She's living in Boston now. She has 2 children, a lovely husband. Husbands are good to go with the 2 kids, you know.
Are they?
Yeah, yeah. I'm just so fortunate with 5 children, all of them married happily, we hope. No marriage is ever perfect, but they married great people. They really
Did
did.
they?
And they're just all good families. We're fortunate to have 15 grandchildren.
Oh, my.
They're just wonderful kids. And Mary is the cream of the crop.
Oh, is
That's
that
why I
right?
let her stay for a week.
Oh.
No one else stays for a week, only Mary. Last year, it was almost 2 weeks before she left. She
Oh,
was
is that
having
right?
such a good time.
Huh?
Yep.
Is this the one that went to Ireland with you a while ago?
No, the oldest granddaughter we took, and that was Olivia. I have to stop and think of all their names. She gets mad because I call her Meredith, Claire. I call her every name except Mary, but you know, I kind of run through all of the names. We
Well,
got
I
there.
still do that with my
Next
dog.
trip.
Yeah.
Next
But Mary
trip, that's
did
it.
go. We took the whole family a couple of years ago, so Mary did get to go to Ireland.
There you
Yes.
go. That's
But
great.
a few years before that, we took our oldest grandchild only. And boy, we're a couple of noses out of gear on that one.
Oh, I suppose.
Yeah, just Olivia. But I said, she's the oldest. What can we do?
Yeah.
So a few years later, the whole family went. That's enough about me. How about Dr. Holm? Tomorrow night, what is your television program going to be?
We're going to talk about suicide and depression.
Oh, it's not a real upper.
Yeah, it's a happy,
Happy
beautiful
talk.
day, and
Why not talk
it's
about
a tough,
suicide?
Tough topic. Boy,
It
there's
is
no
a tough
question about
topic,
it.
and many people suffer from depression. Why don't we discuss that a little bit after this first break? We'll be back right after these words. I'm in the studio, Joan Hogan here with Dr. Rick Holm, and Dr. Holm's program tomorrow night is going to be on suicide, hopefully suicide prevention. What causes it? It's brought on by depression, we realize that, But knowing you were going to mention suicide, I did look up. It's the 10th most common cause of death in the United States.
And if you look at death in the young, it's right
In
up
the
there
young,
at
it's
the top.
even more.
Before we go into this, I wanted
Okay.
to bring up the Shepherd's Gift golf classic that is going on. So here's this brilliant researcher at SGSU who comes upon a way to help Huntington's chorea. And of course, as I heard his story one day in the basement of the First Bank and Trust, because Dan and Barb and the bank has been very helpful in this effort to try to get this going. I heard this whole story. It's amazing the roadblocks research you have to go through to get any research done. And to that end, I've been going through the roadblocks. I finally, our research done, Teresa Binkley and Bonnie Specker and I got the IRB, the Institutional Review Board, okay, our particular research, and we'll be getting started pretty soon. More on that later. But just to know how tough it is to try to get some decent research going. Anyway, I want to say that it's on Saturday, July 16th. It's coming this coming Saturday. They're at Edgebrook Golf Course. The event will be trying to raise some money for this particular Huntington's chorea research. And so call Edgebrook and look into that and consider being a donor or a supporter of this wonderful research and the efforts of finding a way to help.
Just think, this
Go
may
ahead.
put Brookings on the map. We may be known now. The Mayo Clinic is known for the great health care they provide on a world-class basis. Brookings now may become the mecca in the upper Northwest or Midwest for research. You're also going to become involved in a research project, so
right.
I'm very excited about this and this turn of events.
Yes, I am. Well, I mean, research is a real deal. I mean, you're trying to cut the edge and find the new ways to fix problems. It's a remarkable story about what's happened with this, with the sheep, and the way to try to resolve this terrible condition of
And it's not just Huntington's. My understanding, I've read some about it, I don't know if I saw a video on it, but they were talking about it also could be a breakthrough for Alzheimer's disease as well as Huntington's or Parkinson's disease, a
I mean,
breakthrough.
the real hope is Parkinson's
And the
disease.
problem is that it's not pharmaceutical, so you can't get the pharmacy companies to do the research because it's all natural. It's from sheep.
Yeah.
And you cannot, I guess you can't make a similar pharmaceutical that would work or a similar
There's some
drug that would
roadblocks
work.
that you can't
So
believe.
therefore, pharmaceuticals aren't spending the money on it. That's why they need even
Or
more
they're
money
blocking
for
it
research.
because they're doing some other kind of thing that they're hopeful.
But this is a natural way to possibly halt Alzheimer's, Parkinson's, Huntington's disease. This would be phenomenal.
neurodegenerative problems.
Yeah.
They
anything.
can't patent the process of production. That's why they don't want to invest the money.
Yes.
Right.
It can't be
Yeah. If it can't
profited.
if you cannot
just-
profit
right,
from
yeah.
it, the pharmaceuticals will not spend the money on
Oh,
it.
what about humanity? What about trying to benefit people who have neurodegenerative? What about whoever is the patent person who wants to make all the money? What about his or her parents and grandparents and his own brain? Wouldn't you think that you'd try to advance science, for goodness sake?
You would hope so.
Do you
But at least the
remember-
money is being worked on and here, and the research is being done here. So tell us, what is this that's coming up that they can support?
It's a golf classic. It's
Okay.
a tournament locally. And,
Okay.
And I talked to one of the folks that are involved in that this morning. It's near to my heart because Adam DeZeo is one of our neighbors, goes to church. His folks raise sheep and they have for the longest time, and he's become involved in this as well.
So, and it may well be that actually it will be a boon to sheep herders and sheep
Yeah,
raisers.
exactly. That's right.
Absolutely.
Well, and actually, if you think about that, it would also be a huge boon to the land. because the land needs the animals stomping around and chewing on the food and pooping in the grass and making the fields better. That's an important thing.
It truly is.
Remember, about a month or so, 6 weeks ago, they pulled like the head of this pharmaceutical company up there, and they wanted him to explain how it was that this cancer drug that his company made, they were getting $4,000 a dose for, and it cost like $3 to make it. He sat there with that smug, sanctimonious smile on his face.
It was
Remember
disgusting.
I
Yeah,
didn't see it.
absolutely
it's
disgusting.
probably the thing that you did because you just want to reach out and smack the guy.
Throw a shoe at the TV set.
He said when he was being questioned by members of Congress why this was, and he said, well, I have a right to make as much profit as I can on what I make. And they said, well, don't you think that like a 1,000,000% market was just a little excessive?
Yeah.
So, yeah.
But he was the only one with it, so he
You know
could do
what-
it.
They
What
own the
it-
patent. See?
What is it? It's inviting. It's inviting the destruction of that innovative, creative process that could be a good thing. And whatever they've done in the rules about patents and so on has been not always been the best for people who are creators. I mean, if you can buy all these patents up and then you can sue anybody who comes close to you. I mean, what are we doing in this country?
It's a little crazy.
Yeah, but I
Good
don't know
things are
enough about
happening.
it to talk about
Yeah.
those kinds of issues. I can talk about Huntington's chorea, which is a terrible thing, and degenerative brain disease, which is a double, triple, quadruple terrible thing. But let's not talk about it. Let's talk about depression.
We can talk about depression, and depression certainly ties in with suicide. I don't think anyone would consider suicide unless they were depressed.
So here's a point that I made, and this is kind of not that obtuse. So when is physician-assisted suicide appropriate in a patient who has terminal cancer? And I've lived with trying to balance ethics by the three golden rules that I believe in, which are, number one, do good and not bad, right? Do good for some people. Try to enhance wellness and diminish suffering in people. That's number one. Number two is always do it honestly. I mean, as good as you can, which is part of what science is. You try to advance science by wiping out the placebo effect, because that'll mess you up and make you think that something's working when it really doesn't. But also to never say a lie when you're as well as you can. I mean, humans automatically move in the direction of trying to advantage themselves, and so of course we all, end up in that direction. But we have to push ourselves to try to always be truthful. The third one is to respect a person's freedom to choose. Autonomy is a very important issue, and those ethics help guide a person through this whole question about physician-assisted suicide. And if you look at the world studies, what's happened in the Netherlands and has not always been a good thing, because they have done physician-assisted suicide. They've done active euthanasia, which is the physician comes into the house when the family says, Grandpa Joe is getting demented, and he doesn't want to live and go further, and he's a burden to everybody, and a burden to our society, and a burden to us, and it's time to give him an injection. And they have found that in some cases, because the doctor's been involved in very important cases of people dying and suffering, and they've injected poisons. But this one, well, once you get into it, it's pretty easy to that's probably appropriate. I'm kind of the injector of poison, and it's a slippery slope. So I'm not been in favor of physician-assisted suicide, and I am in favor of injecting plenty of pain medicine when a person's suffering at the end of their life, but not injecting that same pain medicine for the intent of killing them. I have a hard time there, because I'm afraid it moves you in the direction of a slippery slope. Well, the other argument is people at the end of their life who are suffering, they have cancer, and it's time to let them go. why, put it off for days and days and days and days when it's going to happen? Why not just give them that poison? And, I have a problem with that. Okay, so let's take it the next step. All right, you don't have to do it, doctor. I'm the person who has cancer. I'm dying. I'm hurting. Prescribe me the poison. I will take the poison. So that's physician-assisted, patient-directed suicide. All right? Now, how much, what is the scenario in that person's life? That person is dying of cancer and is very depressed. How is that different than a person who's very depressed and wants that poison? It's just too close to a slippery slope. And so I guess when a person has, in my own mind, to make some rules that by which they practice, and of course every situation may be different, I would just say I can't go with giving you a poison for you to go off sometime because you're feeling sad because you have cancer and take the poison. The problem is, though, they'll take the poison and then they'll get half of it absorbed and they'll vomit, and then they'll lose half the poison and they won't quite die, but they'll brain damage themselves or they'll be in a worse scenario. And so the rules are, well, if you're going to give a person a poison like that, you need to go there and be near them so that if they do vomit and then they may not quite die, you can inject them with poison, or you can put a plastic bag over their head, or it just goes on and on.
It's a slippery slope.
I'm not comfortable with it.
I'm very happy to know that you're opposed to physician-assisted suicide.
There are people who can argue with me, and with beautiful arguments and compassion and all that stuff, but I'm not there.
Good. I'm glad you're not.
If you're suffering, Joan, and you're in the end of your life, and you call me and say, I need more morphine, you got it, babe.
I got it. Right.
I'm coming.
You are not there to assist with suicide. You're there to assist with comfort. And the comfort level can be reached. So when people say, oh, someone's suffering, they really don't need to suffer. They just don't.
I'm sorry, that was a diatribe.
That's all right. Well, you're talking, and really, when you come down to it, it is someone who's depressed. So basically, you're right back to depression bringing it on. Well, we are going to try to go a little lighter and happier right after these words. We don't have a lot of time. Well, we've got about 10 minutes remaining, but we did have a person call with a question that has nothing to do with depression or suicide.
Oh, really?
Okay, but it's an interesting one. We kidded when we came in and Aaron handed me the thing. I said, you're not going to call your doctor for this, but you could sure call Dr. Holm because you're not going to, go in for an appointment to find out what can you do about excessive phlegm in the back of your throat. I want an appointment because I'm concerned about excessive phlegm. That's not going to happen. That's where this program is really beneficial. Because this person wants to know. The person has excessive phlegm in the back of his or her throat.
Yep.
What can they do?
Well, the answer is that a lot of people have this problem.
They do. I didn't know that.
And
is it older or is it any age?
Any age. And
any
you'll
age.
have it periodically. I mean, when you come down with a viral thing, suddenly your body starts making excessive phlegm. And when I'm coming down with a cold, I'll know it because I wake up in the night and I'm just blocked. I mean, the phlegm is there. I'll go in the bathroom and try to clean out this stuff and open up my airway again. And hacking and spewing and coughing and so on and so forth. Well, the paradox is that sometimes people have thickened phlegm because they're not making enough saliva. They're not making enough juices in their mouths and in their nose.
So then you end up with more phlegm even though...
They feel it's there. It isn't going down. It's stuck. It isn't flowing.
Because you need that saliva in order to swallow.
You need to make enough phlegm. And so the paradox is when you're not making enough phlegm, you can feel like you're having too much phlegm. So the answer in that case is really more saliva. And actually, more saliva is a wonderful answer for a lot of upper airway problems. Think about it. The saliva is our most powerful anti-infective agent that we naturally make almost. It's loaded with antibodies and white cells, along with the fluid that it makes and the nutrients that it has. And so
I had no idea.
Oh, it's
Really?
not just water.
Not just saliva. There's more to it.
Saliva
All right.
has got a lot in it. Okay, so what does it do? You swallow. What does it do? It drains. It sucks by vacuuming the back of the nasal mucosa and drains the sinuses and it brings all that stuff past the vocal cords, cleanses the vocal cords. It brings that stuff past you. If I stopped saliva, if by radiating your mouth because you had cancer, for example, they've learned this occurs, the teeth will fall out. You absolutely have to have saliva for your teeth to stay viable. It feeds
That's amazing.
The teeth.
It feeds the teeth,
gums.
too.
It
Wow.
keeps everything intact in your mouth. And so I'm a big saliva.
Do you know how my mouth is watering as you're talking about this? How about you, Bob? It just keeps watering because
here-
he's
oh,
talking
and he
about
hands
it,
us
and he hands us a mint
a
to
mint.
help us along.
So the point,
Okay.
so what is it that you can do to make more saliva? Well, the answer is, classic answer is lemon drops. Actually, it's any hard candy. Well, candy's not necessarily good with all the sweets in it because it helps decay your teeth. But a non-sweet candy is a good thing. If you get candy that's made with sorbitol, which is a sugar we don't absorb, that'll loosen your bowels too. So I mean, you can double up your problem. If you take something with peppermint or those mint types of things, it often will settle your stomach. So you double up on the problems that you solve. But people who call me with the terrible cold, my first solution is Hall's sugar-free mentholyptus cough drops. I like the mentholyptus because you can drop it in a mug of hot, just tap water, and sip on that as a tea or as a
So just put that mentholyptus cough drop, probably a couple of them, in a cup of hot water and sip, and you're having the benefit of
the menthol,
smelling it to the menthol
and
coming through your system.
You're getting more hydration because this is when you need to make enough hydration, and it stimulates your own saliva. Or you put those cough drops in your mouth and you make more saliva. And so the sugar-free something to suck on,
Okay.
or sugar-free gum will help with the cold and with mucus and so on and so forth. So that was a long answer to.
But
a
if
simple
you have
question.
excessive phlegm, now this person calling in is thinking he doesn't know I've got excessive. If you have excessive, it's probably because you still need more saliva.
Well, no, that can be one reason. If you do have excessive phlegm, you're making all this phlegm. What do you want to do? You want to get it down. You want to wash it. You don't want to blow your nose excessively and ram it into the sinuses. You want to swallow it. And also all that phlegm is just loaded with protein. It's egg white. It's egg white. So suck on throat lozenges. You're making saliva and you help wash all that excess phlegm.
So it'll go down.
But my first point was that many times it's not enough phlegm.
Right. So either way, to increase the saliva will really help excess or lacking of phlegm. Right.
Right.
Very good.
Yeah.
My father used to, last few years of his life, he was always chewing gum because he said his mouth was dry. So that's probably why he chewed the gum rather than, you're just as happy with a hard candy that's sugar-free.
Yeah, both
Okay.
work. Thank you
Very
for the,
good. Well, we appreciate that call, and I think he gave you a wonderful answer. I think you're going to solve that excessive phlegm in the back of your throat. And on that note, we're going to take our final break. We'll be right back. back to Prairie Doc. During the radio break, we were talking, and I turned to my granddaughter and I said, "What is Grandma Hoy?" That's her other grandma. She always has an answer when you have a sore throat, you feel cold coming on. Use salt, hydrogen peroxide, and gargle with salt and hydrogen peroxide.
Right.
What do you think?
Well, for one, it might be really just the right thing, but because hydrogen peroxide will kill dead tissue, you got all this extra mucus and dead tissue floating around back there, and cleanse that and bubble it away. If you've got too much salt, though, there's a problem. You've got to have the right amount that makes saline. Now, if you look up, go to Google and say how much salt to make saline, because you don't want it hypertonic. You don't want it extra salty.
Right.
It's like a half a teaspoon or a teaspoon per gallon. Now, my dad used to fill up a cup of, and would put a third of a cup of salt.
Oh my goodness.
And then 2/3 of a cup of hot water. Well, this is hypertonic saline. That'll draw the fluid out of the tissues, shrivel and dry the tissues of the mouth. It will be harmful to you. So I would say, just about a teaspoon. If you're going to do a tall glass of water, it's going to be a quarter of a teaspoon or half a teaspoon at the most in a big glass of warm water. If you want to add a little hydrogen peroxide, not a problem, and then you can gargle with that. But a lot of people will gargle violently, and all that violent movement is hard on tissues. So I would just say gentle, whatever you do. I kind of like warm liquids better than anything. So drink hot coffee or cocoa when you've got a cold, and take care of yourself and suck on throat lozenges.
And make sure you have enough phlegm, right? It's important for you.
Well, enough.
Not phlegm. I'm sorry. Enough saliva.
Saliva.
Not phlegm. Enough saliva. Well, that was a great question. Really covered a lot of territory, and covering territory.
And Grandma Hoy, is she from De Smet?
No, we're
Not the Hoys from De Smet.
Not the Hoys from De Smet. Hoys from St. Paul area. Yep. St. Paul, Minnesota.
Well, shout out to the Hoys from the De Smet area.
Fine family.
Yep, good people.
We are really out of time. Dr. Holm, thank you so much for being with us. We hope everyone has enjoyed our Prairie Doc radio program, and we'll listen again for Prairie Doc, brought to you by the Vera Medical Group Brookings. And how about tomorrow night, Dr. Holm?
That'll be really great. We're going to have a rerun that is one of my favorites about depression and suicide. It's an important topic. Please take a watch. Thanks so much, Joan. Thanks, Bob. Thank you, Mary. And stay healthy out there, people.